What is this day about? Well, first of all, I want to thank our co-hosts and sponsors, and I apologize for not having all of the logos up here. It's always a challenge to get everybody's logo, and our logo actually has two completely separate logos in it in order to acknowledge our funders, the Chief Scientist Office of Scotland and the Medical Research Council of the UK. But our co-hosts for today, NHS Health Scotland and ourselves, have seen the need, and it's obviously borne out by the response to today's call for applications to attend. We've seen the need for a day to talk about what are the current patterns and trends in youth health in Scotland. What are the interventions, the programs, policies that have been shown to be useful in various places in the world for tackling particularly the risky behaviours that set in motion a life course. Most risky behaviours are set in motion very strongly in the teen years and early adulthood. Given that, we're going to do two sessions on both of those topics, and then this afternoon hear about current innovative programs in Scotland, from particular parts of Scotland. And I think from our point of view, this is just an extension of our mandate since we were founded in 2008, when I was brought from Canada to do this. And that is that our job is different than ordinary researchers. I've been a researcher for many years in public health. I was a GP for 21 years in different parts of the world. But what our job in this country is to help bring together research, knowledge, with decision-making, policy, program, and practice level decision-making, so as to benefit the Scottish population, so as to improve health status and reduce what are extremely steep inequalities by social class. Scotland, I won't have time to go through this today, has some of the steepest social economic inequalities in health in all of Europe. So these inequalities are, again, strongly begun in youth. They begin to diverge. The different social classes' health begins to diverge very strongly for the first time in youth. And it's therefore particularly appropriate that we spend a day understanding what's going on with youth. As a father of, with my wife, of 3 boys, just finally, did I say finally, passing through teenage life, I do have a few scars, I admit. On the other hand, I have the pleasure of saying that those relationships are now the most important in my wife's and my lives. So I think you know, there is something that our society has to face, which is negativity towards youth has somehow peaked in recent decades. And it's ironic because if you go back before World War II, youth were, at least at the teen level, fundamentally invisible. They were just apprentices to life. They just started work if they were working class. They just stayed in school if they weren't. And so there was no kind of youth culture. But by the 1950s, of course, we saw this extraordinary rise in the way in which youth culture was somehow seen to lead other culture, at least to have a great deal of fame and glitter associated with it. And now, ironically, and at this time, we've seen a kind of a fall from grace and quite a lot of media negativity towards youth, which is something we all have to consider in our deliberations today. So without further ado, I'm going to introduce our first speaker, who is himself in the age group in question. Grant Costello is the chair of the Scottish Youth Parliament. He has quite an interesting background. He's not new to this. He's been elected to the Scottish Youth Parliament for East Kilbride since 2008. And he's particularly involved in linking the Scottish Youth Parliament to organisations active in the youth field. Youth Scot, Youth Link Scotland, and the cross-party, Scottish Parliament's cross-party children and young people's group. And so I think he's well placed to give us the youth perspective on health and well-being in that age group. So, Grant, welcome.
Thank you very much for having me here today. The ironic thing is, with our assembly point being at the George Hotel, I actually couldn't find my way here today, and I had to go to the George Hotel to ask where to come. And the only reason I found out where this was is I bumped into the sign that was outside that said Royal Society for Scotland. As I said, thank you very much for inviting me here today. As John said, I am the chair of the Scottish Youth Parliament, and I'm here today to sort of offer the opinions and views of the young people of Scotland, as that's what the Scottish Youth Parliament does. It represents the views and opinions of all the young people of Scotland, and it is elected by all the young people of Scotland. Now, as hard as it might be to believe, the majority of young people in Scotland actually have opinions, very strong opinions, on issues like health. I might even excuse you for thinking that young people couldn't possibly have a constructive opinion on this extremely complex subject. Young people certainly wouldn't be able to put their views and opinions into the slideshows and constructive way that the speakers today will put their opinions and will put their research into. However, young people in a different way have opinions, in a different way express their opinions. As a young person, we express our opinions mainly through our actions. And if you look to things like smoking is the best example of this. Most young people think of smoking as a horrible habit, and I apologise here to anyone who actually smokes. But they do, they think it's an awful habit. And I always look back to my history. When I was young and I was 2, I used to take my mum and dad's packets of cigarettes and I used to throw them in the coal fire that we had when I used to live on a farm. And they used to go mental at me. But that's the opinion of young people right now. They have a keen sense that smoking is bad for your health. So what do? You destroy cigarettes. You don't smoke them. But that opinion is just sort of washed over because it's not put in the slideshows and it's not put in the large research papers and it's not presented at these sort of events. It's just washed over. It's not really that important. They don't really understand what's going on. But that's obviously not true. The Scottish Youth Parliament, obviously, was one of the key members of the grassroots level about bringing through the Scottish Parliament's ban on smoking bill in public places. Following that, 1 year later, an MSYP was elected to the Scottish Youth Parliament just on the basis of expanding the smoking bill. And then we've worked with the Scottish Parliament to try and do similar things. So I think that might give you an idea of just how much health issues are ingrained into young people. They might not present it in the best way, but by God, believe me, we discuss it. But smoking is just one example of health issues that young people consider. We have a range of discussions and a range of opinions following on from alcoholism and how to tackle that, be it through minimum pricing for alcohol or be it through another method, all the way to mental health issues going from your grandparents possibly having Alzheimer's. But young people also lead on health issues. We don't just discuss it and we don't just try to interact with it, we lead on health issues. And the best example of this is the mosquito device, which is led by a young person from the Scottish Youth Parliament and the Scottish Youth Parliament's Health and Wellbeing Committee. The reason I bring this up is because this is young people directly taking action on health issues, directly going to the Scottish Government, trying to change their opinions, trying to change public opinion of a health issue. I think that's important to realise in an event like this when we're discussing how young people can be involved in making policy, how young people can be involved in consultation events, because it's not as though we don't want to be involved in these. It's not as though we can't be bothered or we'd rather go and watch the football or we'd rather see what's on the TV. We do want to be involved in these in circumstances upon which it affects us. And I think things like that actually show that. Now, the reason for mentioning all these different things that the Scottish Youth Parliament's done and all the different things that young people has done is to simply disprove the general assumption, which I said right at the start, that young people simply can't have constructive opinions on health. It's false, it's wrong, and it needs to be ignored. As John said earlier, it's sort of part of that media culture of dissing young people, of saying that they don't have constructive opinions, they don't have a part to play in society, they're devils, they're just pain in the asses that need to get rid of. That's just not true. Young people have specifically been attracted or affected by health issues all their lives. As John said, when you're born, you start off in that social class. If you come from a very, very poor background, somewhere in Glasgow, you might very much not have much good health because you might live in poor housing. You might live in a family environment where the NHS free health service isn't all that much promoted, so you don't really know much about it. Or you might come from a very, very rich background where you have the private health care, or you go to the NHS and you know everything that's available to you. So it's important that young people are involved in discussions like this, and I'm very, very happy to be here today to sort of talk about this. Now, I think the way that you have to convince people to get involved in this is to let them know that this is about expressing their opinions. It's not about following on from, you know, the general idea of smoking is bad, or alcohol is bad, or drugs are bad. It's about letting them express whatever opinion it may be that they hold. Now, I'll often admit it's not the easiest objective to get a young person in a room to sit down and to listen to the experts talk and then to get their opinions. Young people can be very, very timid. They can be shy. They cannot want to talk about these specific issues because the simple fact is they don't want to look stupid. They don't want to look like they don't know what they're talking about and have their answers thrown back at them and say, well, the Scottish Government did this, or a research did that. So that's a fear for young people. And that's why when you're involving young people in discussions, when you're involving young people in consultations, my advice will always be have it peer-led. Have another young person in the group facilitating. Yes, it's always important to have that expert there to throw in questions, that expert there to question the opinions that young people have, because the opinions won't always be right. But it must be peer-led because it gives young people that feeling of safety, that feeling that they can come out of their shell, because they're not going to be judged by the person that's leading it. Because the person that's leading it's just one of them, might be 2 years older than them, might be 2 years younger than them, but they're not an adult, they're not someone you have to look up to and you have to respect, because they've been through life. It's a young person just like yourself. I've always found that whenever I've held events, especially when it comes to events such as health issues, especially mental health issues, having a young person leading it, especially when I've been involved in it, having a young person leading it, you feel comfortable, as I just said. Now, it won't come as any shock to many of you, because I imagine most of you have been involved in countless debates and countless events and countless workshops, but the person facilitating an event always leads the direction of a conversation. They always lead the general idea, they always lead the general trend. When you have an expert leading that general trend, it gets into very, very key aspects of, for example, health. You could go into very, very key aspects of Alzheimer's disease, the effect that has on the brain of an older person, the effects it can have on the family. But when you're talking about that, that's not what a young person wants to talk about. A young person wants to talk about the effects it has on them, it has on their culture, it has on their family life. On smoking, it wants to talk about the effects it has on them. So that's something that needs to be key when looking at consulting with young people, understanding exactly what they want to talk about, and then trying to change that into what information yous are wanting out of any consultation event. The obvious way that consultation events work is flip chart paper and asking young people what they want, asking young people how best should we do this, and have you agreed with this point, and what else do you think? That's obviously the best way to get information, but it's not always the best way to get information from young people. It's got to be more free-flowing, it's got to be more entertaining for young people. A situation I've always used is to have a mock press conference where you get young people to go up on a stage and fill a role, any role you've decided. And then you get the other young people or the other adults as part of that workshop or discussion group to challenge each other, to ask questions. And when you're the expert sitting at the side, you can then pick the points that you see coming from the young people, because they will start to grow out their shell, they'll start to feel much more comfortable, they'll start to get involved and entertained in the debate. And that's the most important thing when discussing an issue like this, is getting that enjoyment factor up. Because when you get that enjoyment factor up, when you get young people interested in something, they're much more likely to join a debate, they're much more likely to challenge you on something. And I think you all understand that when you have a workshop, you don't want people to come and just nod their heads and say, you're fantastic, I can't believe you thought of that and we didn't. You want people to challenge you. You want people to say, no, I think this, or no, we believe that. That's something that's got to be made very, very clear. When you have young people, they need to be energised. That is so, so important. Now, it's hard for young people, especially when it's an event like this. As John said, I have quite a bit of experience in this, so I don't have so much of the fear of standing up in front of an audience like this, but it is a very, very intimidating thing. And I think that needs to be noticed whenever any of you work with young people. When it's a one-on-one scenario, it's extraordinarily intimidating. It won't work. When it's a 100-on-1 scenario, it's extraordinarily intimidating. It probably won't work either. You need to find that right mix of people, that right mix of adults, that right mix of experts, that right mix of people that are utterly clueless and don't know what they're talking about, which is generally me in those situations, and the right mix of young people. Not to be tokenistic and let them know they're not being tokenistic, because that's a young person's fear. It's when you're in this sort of field and you get invited along to these events, am I going along to this so they can tick the box and they can say, we discussed with a young person, now you can choose the fairy lights that go up around the situation where we discuss the grown-up stuff? Or are they going to be there to discuss the actual policy aspects, the actual meat and bones of the discussion? That's what you've got to convince young people they're going to be involved in. Because when you convince that, they get interested, they suddenly click on that what they say is going to actually affect something. And that's really, really important. I don't have much more to say. Obviously, later on, there's going to be questions. So if you have anything, please ask me about that. But the last thing I'll say is, young people enjoy this kind of thing. It's not like a holiday out, but it's a break. It's a break from the norm. It's a break from being treated as a young person. It's a break from looking at the papers and seeing that we're all crazy, antisocial idiots. It gives us a bit of respect. And I think that's what everybody in society wants. They want to show they've got a bit of respect. And I think when you invite a young person to something like this, and you invite young people to offer their opinions, they feel respected, and I think that's a key aspect of our society. I want to thank you for inviting me here, and I think young people will be the same when you invite them to your own events. Thank you.
Well, Grant, I think I see why you're the chair of the Scottish Youth Parliament. You're a very, very compelling speaker, and I think I took away something there about anything that we do to achieve youth engagement. You gave us some very, I think, clear and wise pointers about that. And, you know, this meeting wasn't set up, as you can tell, as a youth engagement meeting, but I think whatever we do in the next few years coming out of this meeting, we need to take your advice very seriously. So thank you for staying with us, and thank you for doing such a good job on that talk.